Good morning, good afternoon, and good evening. Welcome to the season premiere of the IFA's Global Café. My name is Gregor Snedden, Secretary General of the IFA, and our mission is to advance the agenda of the world's aging population. As a global hub of experts and networks, the IFA works to influence and shape age-related policy with a clear recognition that aging is cross-cutting and intersects with diverse health, economic, and social challenges and opportunities. It's so great to see everyone, so many familiar faces and friends. I hope you all had a great summer. And we saw many of you at our global conference just this past September. So great to be with you all. Please remember that this session is being recorded. The recording will be available by the end of the day on our YouTube page and website, ifa.ngo. This session is also being live streamed at our Facebook page. And we encourage you all to participate. So if you have any comments or questions, please make sure to pose them using the chat function, and we'll try to get to a few questions towards the end of the session. Please be aware of your microphone and keep it muted. This helps minimize background noise and ensures we can hear clearly. Today's session, Financing the Future, the Role of Development Banks in an Aging World, is a critical and pressing topic, as we are all participants in an evolving and rapidly changing global economy, driven by the biggest social and structural change in generations, population aging. I'm speaking to you from Paris, France, where it took 150 years for the population of people over the age of 60 to grow from 10% to 20%, whereas for much of the world, the same transformation is happening within 10 to 20 years. Today in Europe, a child born will have a 50% chance of living to 100. That's an unheard of thing to say even 10, 15 years ago. As we see population aging transforming our world, by 2050, more than 70% of older people will live in low and middle income countries. We don't have 150 years this time. We must build equitable policy structures, build our health systems, and design our communities to embrace the challenges, but most of all, the opportunities of aging. And this is a collaborative effort. We must work together in our communities with our governments, civil society, academia, industry, and finance institutions to build a world for all ages. The IFA is working with development finance institutions to support the development of global strategies to address global investment on aging. And the Asia Development Bank is a leader, a pioneer in addressing this question, as Asia is the most rapidly aging region in the world. The Aging Well in Asia Report 2024, which we'll post here in the chat, is an exceptional report with evidence-based research and implementation strategies that narrates the ADB's outstanding creative work in addressing population aging in Asia. And so it is my privilege and honor to welcome the lead author of the report, Mrs. Aiko Kikkawa. Aiko is the senior economist in the ADB's Economic Research and Development Impact Department. Her research portfolio covers population aging and demographic change, international migration and remittances, and economic analysis of development projects. She is the lead author of the Asia Development Policy Report 2024, Aging Well in Asia, and the Asian Economic Integration Report 2019-2020, Demographic Change, Productivity, and the Role of Technology. She currently leads ADB's Technical Assistance Project, supporting the introduction and implementation of aging and retirement surveys in Asia. Welcome to the Global Cafe, Aiko.
Thank you. Glad to be here. Thank you very much for invitation.
Now, Aiko, I wonder, as we do on the Global Cafe, I wonder if you might share a little bit about your own journey into this work. I mean, as an economist, you have a very interesting focus, and your thinking and working around aging in particular. Maybe tell us a little bit. How did you? What was the road that brought you here?
Sure. Actually, my first encounter with this topic of population aging did come as a form of a work assignment. So that as soon as I joined ADB in 2017, first task was to review China's 5-year development policy. That time, that was the one that scrapped the one-child policy, two-child policy, and what's the impact on fertility, and running, modeling and so on to see what's the effect. And we know the effect. It had very little effect no, on fertility in the end. And that, what happened was that that is bringing huge pressures to the Chinese government in terms of how they can mobilize that workforce, how they would take care of the older person. So that report, working on that analytics, gave me a first encounter really to look at the issues. Then after that, since ADB started to have quite a few portfolios around the aging, like pension reforms, long-term care. So many of the research actually landed into my desk, and that actually gave me the first sort of encounter. But maybe more on the personal side, I did have an experience of caring for my families, and that as I learned a little bit more about the care and the need for long-term care, we were maybe one of the few families that has really profited from the long-term care insurance that Japan has just introduced. And we were, very lucky to have helpers coming to our house while we take care of a mother. Doctors would visit. We were able to rent many of the equipment, putting an escalator in the house, all this with the long-term care insurance. So we thought, having this kind of support for the caregivers are really essential for, small families, and something that the countries like, middle and low income countries would need in the future. So I feel a little bit more personal about echoing the importance of supporting family who give care.
Hmm. Hmm. Yes, it's something we all engage with and face, and it's exciting to think that there is some building momentum and attention for people to recognize this as a global issue to be engaged with it and address. And as I mentioned, the demographic shift in Asia is both dramatic and it's imminent. In your view, what are some of the economic or the social risks if countries fail to embed aging in their development, their development agendas now?
I think first of the thing that comes to the economist's mind is, of course, the risks to the financial sustainability of social protections of the pension. Currently, majority of the people are not covered by any of the work-related pensions. Some receives like social assistance, but with the kind of demographics happening with such a low coverage, it's going to put a lot of pressures on many of these economies' physical floor in terms of financing this social protection. Second is the risks to health of the population and also the rising health cost. Unhealthy aging process is very costly, and there must be some other ways to make it better. Ultimately, I think these risks also really constrain these already, aspiring, growing countries to grow further, because then they will be having less healthier population if they don't invest, and that they will have fewer children who they can rely on, and that and not having good social protection really start making people, save and not consume, really start saving up for futures. That's what happened you see in
Mhm.
Japan. So it brings down the country's potential to prosper. So it's a really not a small social issue, but it's really about the more fundamental issue that can constrain growth in our view.
The report, which again is in the chat, it is so powerful and so readable, and even the website itself, it's just a great resource. You obviously worked really hard at research and producing some really powerful data and analysis. But what's working when it comes to translating these insights into real policy change at a country level? could you share some examples where some of this evidence has catalyzed some real investment or reform or change?
Sure, we can probably talk in two ways. I'm from the research department where we can get best is to provide policy advice. So far after the publication of the report, we have been asked to do some diagnostics with some of the countries, like including China, Tajikistan, Bangladesh, these countries that are currently going under big pension reforms or long-term care, planning to really make use of this micro data we collected through the report to fit into their policy diagnostics. You might want to reform this area of the pension. The vulnerable group who doesn't receive pensions are this group. So we were able to provide those policy advice. But maybe more concrete way is that since we're research, but sort of bread and butter of ADB is to provide loans for countries to implement bigger reform, like real social, new pension program or building geriatric hospitals, providing a center for supporting caregivers and training caregivers. So those are the real drive that our project officers are now really using our report to lobby the government so that they would consider you know uh, working with us and use our investment to make this change happen. So we see a growing number of those projects now.
Hmm. And do you just a question on that when a development bank like ADB makes a loan or investment, what are some of the ways that those loans are structured in the sense of working with governments or private equity, or what are some of the partners that you use, and how do you bring those together, those partners?
Yeah, so again, talking from the research side, my account might be more secondary, but how we would have with these countries a long-term, like 5-year plan, whereby we already set where the country's priorities are. So if in China it's the building of age-friendly cities with care facilities, those are sort of predetermined in the earlier negotiations. But there would be some interesting building block that we would consider. For example, is it simply fund going into the government? Are we also pursuing private and public partnership? For example, for the service provider of the cares, are we bringing in the national government to have national, care system? Are we looking just at the provincial pilot system? So depending on the country, there will be a lot of different financial modalities. And in addition, countries like China, of course, we lend, but there are other countries which would operate these more on the grant base. Then that's going to be more of, no loans, but those are used to finance and test some of the models.
Okay, interesting, interesting. What a creative process to engage in. One of the things that's really notable and that is important to the IFA is the way we reframe aging, uh, not as a burden, but as an opportunity, as a foundation for growth. I mean, yes, there are challenges, but it's also a tremendous opportunity. Sometimes, and in the report, the silver dividend. Why do you think framing it in a positive light, or framing it in those kinds of terms is important, especially in low and middle income countries before they've really developed? Why would we choose to frame it in such a way?
Yeah. So for these middle and low income countries, it's surprising to note that some of these countries are already experiencing either contraction of the share of working age population, like the countries like Thailand, or actual contraction of the workforce, which means that they would want to draw on any workforce they can tap as a way to continue their growth. So, in that perspective, I think many countries are already understanding the change. And our report clearly points out that this reframing is not just how do you say, things we just echo, but the changes of the importance of the silver dividend are really backed by real data. So why we think older persons are no longer considered burden, but a source for prosperity and the growth. First, we noticed, for example, the years of education or the rate of illiteracy have dramatically gone down in the last decades, which means that the difference between the productive, age group and people after the statutory retirement, that is narrowing. It used to be very wide gap, meaning to say that older person remains illiterate in many of them, remains illiterate in our regions, and that become quite dependent on many of the activities they have to do. But that's not true. Then life expectancy about probably on average grew about 20 years in the last few decades. That's quite an achievement. And that really goes to show that they are real, change in the human capitals of older person, which we probably shouldn't call a 60s and 70s an older person anymore. They are productive working age population. Of course, there are differences and there are people who are unable to work and we need to really acknowledge that, but there'll be a lot of population who are interested to work. So, I mean, there are different ways to define what's silver dividend, but we did some calculation that what if people who are in 60s and would like to are healthy enough to work, what if they work and able to contribute to society? So we've worked with the scholars in the country, about 8 countries in the region, to estimate what kind of economic growth does it bring. And our estimates show that about just working with people in 60s who are not working but are able to work would push the country's GDP on average about 1%. That's a big number, just considering people in 60s. And for the country that has larger number of older person, it can go up to like 1.5%. That's quite significant, values. And we're just evaluating these workforce with a minimum wage. And none of these people will be probably working in that, range. So just looking at these small silver, one side of the silver dividends are huge. So what if we look at the greater number of people, more, expertise they bring, more, mentoring role that they can bring? I think there are a lot of possibilities, which many of the Asian countries which are gradually aging are not yet fully sort of leveraging that. And there's so many things they can do really to leverage these hidden talent.
Yeah, I think I'm here at the OECD, and we were here. Or I'm here at a workshop on labor force for the future, and some really amazing research as I was preparing for this. That one statistic shows that for startup businesses, people over the age of, I think it was 55 or over 50, have a 70% success rate, whereas under 50 or under, I can't remember exactly, was 28%. So just in terms of ingenuity and startups, investment, that age gives it, I guess, a maturity and an ability to be successful in launching and creating new businesses. Also, the ILO has different measurements for unemployment or measuring employment, like labor underutilization, for example. And it really kind of suggests that the drag on GDP of employment with older people is less so about their activity, but rather their exclusion from the labor force because of things like inflexible retirement plans, or we're not able to stage or adapt very well to the needs of older people, including on health. We one of the biggest reasons why people leave the workforce after 50 is a shock to health, and it's a real loss because it's suggested that because we don't have policies or frameworks that could allow a person to return to work or flexible ways for them to continue working, we're missing a whole a whole opportunity with older people to be incredible continuing drivers of the workforce. And we still continue to note that in much research and in much drivers, for example, on NCDs, non-communicable diseases, we are always framing subjects in terms of unnatural death being before 70. And as if the data or what after 70, it doesn't really matter anymore. And yet we still, even at a policy level, just are not grasping that, as I mentioned at the beginning of our talk today, there's no reason people will be living to 100 through prevention and proper treatment and healthy lifestyle and so on. So I think, yes, to your point, there's just so much tremendous opportunity, and we can't just keep evaluating things as a burden and as a cost, but as the inherent opportunity ahead of us. On that note, in many people, older people, whether it's caregiving or otherwise, work in informal economies where they don't collect a pension, where they don't receive long-term support, underpaid, undervalued, and not recognized by economic assessment. In the world, that can be as high, is 60%, but in your report in Asia, it's 94% of people, is it between 50 and 70? I can't remember the exact specifics. 94% are working in an informal economy. How do you see policy and financial intervention shifting or recognizing or engaging in formal work to more protected and productive forms?
Yeah, this informality of work, I can, especially among older person, the higher informality among older person can be explained by two reasons. One is that many have retired and going to the second job, then that's not not under full employment, or that not covered by regular employment record that comes with different benefits. Second, though, this is particular to Asia, is that it's the agriculture that employs over 50% of the workforce. Still in rural areas, small scale farmers, and these are really the groups that the agriculture is the main employer of older people in our regions. So to make, I think it would be quite important, yes, including them in social protection and so on would be something that has to come. But first, most probably important thing is make this job age friendly, because those are quite strenuous work. And that, of course, in case of injuries and so on, very little coverage. So, we feel that, and we know that the farmers' average age have really gone up in many countries in the region. If you're aware, like average age of farmers in Japan is now like 67. So
Wow.
that's how many of the Asian countries are heading to, and they would really need this mechanization through some support to make their work, first of all, less injuries and more sustainable, and they can continue for some time. So this is quite an important part. Then also to have reform the policy. I think trend now is that let's accept informality. Unfortunately, even for the productive age group, the informality hasn't gone away as much as we hope to. And this is exacerbated with platform workers and so on who are coming in. And so many youth coming in, you don't really see a big improvement in formalizing jobs. So what governments are, experimenting now is to come up with a system where even informal workers or the contractors can contribute. It could be a little bit more flexible or have some incentives like matching fund, or comes with some insurances, or you can stop and go. Maybe you can also change the contributions. So make it flexible. That's not the golden thumb that solves everything, but at least those who can save can start to save and have some scheme. So that seems to be the trend, and this has to also come with more of social pension, like assistance, cash transfers, because those amounts are not enough to provide for the basic needs for many older people in the region.
Där försöker jag övergå. Simon, en del av
Oh, I just wonder if we
Yep.
want to. Yeah, great. Someone had their mute off there. And really interesting. We again, we were talking. Was I've been at this event at the OECD. We had a great presentation from a keynote, Beth Truesdale, yesterday, talking a lot about these kinds of things. And there are other matters that were brought up, including stigma of aging, and some of or if you have health issues, that you need to have adaptable, flexible programs at your work and so on. And again, it brings up that sort of structural ageism that we all are subject to and participate in the way that we think about employment and how we participate in an economy. And one of the interesting points that Sue Tresdale brought up was having programs really that are universal. So is it really about age-friendly workplaces? Should it just be friendly workplaces that is adaptable to all kinds of people with different kinds of needs as we move forward, so that we think even larger than just in terms of aging, but we think about the future, and having adaptable programs, having friendly environments for people to engage in that are ergonomically approachable, and that adaptable ways of working that can fit different lifestyles and needs, maybe as a caregiver, or you may be better off just suited for your circumstances working part-time, or you have a health matter. So instead of it being unique interventions for particular populations, we really think redesign from a universal aspect to be able to benefit from and engage as societies with all the gifts that people bring, as a community. Maybe let's just shift for a minute over to long-term care. And that, when we say long-term care, that's institutional, it's community care, it's home care, it's how do we age for the long term? I always love to remember and remind myself is that aging it's a life course approach. There's only one alternative to aging. If you're not aging, there's only one alternative. So we want to age well, age in place, and what is that journey, or how do we narrate that? Um, how do we address that need, considering also from a gender perspective, fertility decline, women age longer than men? Is it robust technology? Is it a change in our cultural norms, our behavior? How do we build public support and awareness of this issue? What are the key pillars we need to address, and how do we engage and build that public support around that?
So we as an ADB typically support government who are considering then what are the pillars that they need to think about when they want to build a long-term care system. And they always say, oh, let's build an institution, care institution. We know that that's not the case. Although research shows that younger cohort of older persons are more willing to consider living in the care or older person's home compared to current generation. That said, so we feel that it's not about building institution or the buildings, but it really consists of five things. First is about the policy, but also with good governance and leadership, because this needs a lot of coordination. It's about the health, it's about the social protection, it's about the communities, region, national. You need a lot of leadership.
Mm,
So that's where we are trying to foster through different forums and so on. So second, of course, is the financing. There are different models. Like in Japan, we have an insurance. Other country, they do as a part of social assistance. Others might have more private sector coming in, others. But the financing part will be an important pillar, but not the only pillar. We also feel that the service delivery is now critical because people would be using either public fund or the vouchers or other ways to seek different home services or care services at the institution, daycare services. And even in Japan, we now hear that these like home care service providers are in much undersupply because these are not being managed sustainably. So like having a good service delivery, having a multiple, private, also non-profit sectors, how do you foster, how do you work collaboratively with them? So this service delivery is the third pillar. Fourth pillar is the workforce. So in our region, very different from maybe many of the audience here, is that about 95 or plus of the care workforce are informal and family caregivers. And very limited number of the people use special caregivers. Many would have domestic helpers as the support, but not properly trained. So just starting with the workforce building is a big challenge for the government. And lastly, but importantly, we feel that given this, age of technologies and information, we want to build a good information system so that governments can plan ahead and also have good information on how to take care of different needs of the older person or forthcoming generations of older persons. So those are sort of five areas that we would want to see it coming.
Hmm. Very interesting. Well, there's a lot of chat actually from some of our folks here in the cafe today talking about volunteering. And Catherine Klein asks, who's estimating economic value of volunteering? Like, what are the measures or the tools? Is that translated into financial numbers, quantifiable that we can? Who's doing it and how do they do it?
I think it's the accounting, national wealth accounting people who does like informal care. What is the national values? I don't particularly involved myself in doing this, but I yeah, that's a big amount of work that is non-quantifiable and haven't been probably not quantified enough to measure it. Of course, there's a little bit more, you know, subtle nuance you need because
Yeah.
we tend to value everything in money. So yeah, that'll be a very important work. And we know that many of the community works are led by, volunteers and including majority of older persons groups and so on. So that's going to be quite an interesting initiative to do that.
Mark Venning notes in the chat too that of Statistics Canada, there's a value of volunteering wheel that he has shared in the chat that
Mm,
would be interesting to have a look
yeah,
at.
yeah,
Um,
sure. Thank you.
yeah, that looks really interesting. Um, what does it take to work when we're working with, we often talk to, as civil society, we often talk to governments and we talk to ministers of health and we engage in all kinds of conversations. But what does it really take to really make this clear to finance ministers and finance and ministries? And multilateral banks that healthy aging should be treated as an economic investment, not just a social cost. Like, what's the ROI? What's our return on investment? How is that being
Mm,
best defined? Best defined, and how can we really make clear that to finance
yeah.
ministers and institutions?
Yeah, in our work within ADB, we usually do the economic return to investment of our, project. And health usually have a very high number, especially if it's the preventative or public health. If we invest a lot in the intensive care unit, perhaps not so much. But if you're talking about preventions, awareness, having an annual checkup, those have high returns that are even sometimes higher than many of the infrastructures or energy projects. So we can assure that these health projects have high return. Why? Because it's really quite easy to monetize. We're talking about lives and we're talking about productivity. We're talking about, reducing the cost of the people who care if you are sick. So these costs are really, you know, if you monetize it, the returns are quite obvious. So I think there's not so much doubt really in investing in healthy aging. And one another thing is that, ultimately government would want to ensure the well-being of everyone in old age. Then when you think about then what do we mean by well-being, which was, the kind of the theme of our report, we really looked at then what are the determinants of people feeling satisfied with their lives or not feeling well about their lives. Then health comes as the top determinant,
Mm.
not the financials, not the having access to pension. Maybe some of the having family plays a role, but health and having an able body to be able to move around was the top determinant. And any government who would want to, foster aging well and having a happy moment in the later life, it's really the health. And that I think is also quite convincing that you want to really invest in health as the number one priority when it comes to ensuring well-being in old age. That's what we find in our recent report. We looked at different studies from psychology to geriatrics to sociology to economics. All says the same: health, both physical, cognitive. Ability to move around, all are very important determinants of happiness in old age.
Hmm. Yeah, health systems really are still designed for crisis management or dealing with one particular chronic disease at a time. But we know that we deal with multimorbidity, and we don't. Our health systems are not designed, or they don't do well managing older people's and morbidity. Just another really interesting statistic is that, we know that every dollar invested in adult immunization has a 19 times return within 1 year. Not a long-term investment, but any investment annually in adult immunization, 19 times return. Just think about vaccine preventable respiratory diseases like pneumonia, flu, which are annual recurrences, which affects workforce 19 times. So for governments or systems not to be investing is just, shooting a shot in the foot, as you can imagine. Cynthia asks, Cynthia, maybe you want to ask yourself your question?
Sure. Well, thank you so much. Are you getting feedback?
Yeah, maybe I'll ask your question for you because you're echoing there. But Cynthia, who is our main representative to the United Nations with the IFA, she's asking about, does Japan have a age requirement for retirement, and is there a plan to raise it, or are there ways to encourage older people who are able to work to continue doing so?
Okay, so Japan is with the front runner in increasing and stepping up the retirement age. And also, so it depends on which age cohort you're in when you retire, because it's gradually changing. But interesting part is that then for the corporate with with some X number of employees or above, they encourage older person after the statutory retirement age to rehire and retain for another 5 years or so. So those are becoming sort of a practice. And if the firm does not follow that, I think they would be facing some consequences. So yes, there's a retirement age plus some X years of extended contract, perhaps not in the same term, but in some form, so that they would continue to be employed. So, and Japan is, I think, considering raising. I think government won't say that, but they are continuing to really raise. And we hear that by the time I would retire, it would be around 70s or above. So that's quite progressive. And you're probably aware that China recently announced the retirement age rise by about three years. So it's really a trend now. Yeah, in the region, really, many countries are raising it.
It's interesting. There was some further comments in the chat around, well, Nancy Wagachu talks around, 80% of older people are in the informal economy. They're doing agriculture, social enterprise, like crafts and so on. In fact, she talks about launching a pension club, which would be an informal, self-organized pension program within their communities. What's the critical data and knowledge gaps that needs to be filled? Like, what are we missing in order for policymakers to really build those effective policies, to make those changes so that we can support aging populations? How do we move that forward? What's the data we need to drive the evidence that we need to drive policy forward?
So in the US or Canada, you have a good micro data that like a health and retirement survey that tracks people over time. So you understand how people who are born in 20s or 30s are aging and what are their progressions of the process. For our region, because I mentioned about this rapid rise of the education, rapid extension of the life expectancies, it's very difficult to imagine that how older persons are living now will be what the picture is like for future generation. The change has been so rapid. Like you said, it took 100 years for France to go through the demographic change. These guys are really fast. They've been immunized fast. They've been educated fast. So this whole process is shrunk. So I think what's really needed, and that's what the ADB is currently doing, is to help these countries, emerging countries of population aging, to collect microdata and track same person over time. So we understand better about what is the aspirations, what is the work pattern, what do they hope to do when they retire, and do they have pensions? All this idea has to be tracked by different cohorts. Just to give an example, maybe half of our samples that we collect those microdata from, we now collect in Bangladesh, Indonesia, Malaysia, have not been to school. But we would see in the latest cohort, like 40s, we rarely see these groups. And there are different aspirations, different work patterns, how they hope they live with families or maybe live independently. All these expectations are so different. So I think it's very important for this country to collect data of broad range of mature adults and to really use that as the way to inform policy. Because without that, you don't know what kind of pension policies you would like, what kind of health interventions are needed, because current older generations will be so different from the future generation. So that's what we hope to do within the research part of the ADB.
It really became clear, especially in COVID-19, with the utter lack of disaggregated data for people over the age of 50. And so many places still collecting data with paper, versus, so I think that we have a lot of work to do together to really get a clear picture and to be able to help design that work. Well, thinking about that, this work, it's cross-sector. I mean, it cuts across everything, aging, whether it's health, work, care, health systems, social isolation and loneliness, social determinants of health, transportation, agriculture. I mean, you can address aging, and it should be addressed in just about every possible sector that we can think of. How do development banks and governments align their financing around aging across such diverse sectors? Are they doing it? And are there any models we should be looking for? Like, do you prioritize a certain set of sectors together when you address these, or are you simply looking at aging in a siloed way as well?
I think we are pretty sort of flexible and could be considered even eclectic in certain ways. We do have a modality called multi-sector project. So for example, just to give one in Guangzhou in China, there's an age-friendly city construction, but also coupled with the health system support, and also some other health care workforce development component attached. So these multi-sector projects, which are a little bit more difficult to structure because you have so many audience and so many coordinations, but those are something that ADB does at the request of the government. So if they have grand plan that they want to implement with multi-components, there's a way to do it. But maybe more realistic and typical approach is that we do finance, for example, in a big health program, health reforms. Then we would want to ensure that there would be a specific component that looks at the geriatric cares or integrated care for older persons, or some different particular type of need that older person would need that is differentiated from other age group. So there would be this kind of a mainstreaming on big project, and that's another approach that we do. So it really seemed to be quite, and also social protection. Sometimes we have a big social protection reform, and pension is one of them. So I think that's more realistic because many of the projects are thematic. But then the mainstreaming, there will be always, as we do with the genders or environment, there would always be people who would be ensuring that there will be the need of older persons are taken care, and that's also part of our approach. Now we call it intersectionalities, where we would consider people of the different needs, and the age is one of the categories.
Interesting. Interesting. I wonder if there's opportunity to look at to consider some framing around investment on the decade of healthy aging for impact areas, long-term care, integrated care of older persons, age-friendly environments, communities, and ageism. Those could be four areas that you could structure something that I think would address a number of sectors. That could be an interesting, maybe for another global cafe. Well, thank you so much for this incredible conversation, Aiko. I'm going to just leave you for a minute just to think about, maybe you could just share, what would you say would be the top two or three things that you feel we need to really be intentional in directing our attention towards for global investment on aging for our future? What would be the top three things you think are the most important? Just maybe take a second. The IFA, everyone, will be convening a number of roundtables on the subject of global finance and healthy aging in this new year. So please stay tuned. That'll be an organized program of work that we'll be sharing with you over the coming months. So please stay tuned on that for this critical conversation. And this has been the season premiere of the Global Cafe. As you see, we've moved to a monthly format. We welcome your feedback on how you feel the series is going. Our next cafe is scheduled for November 13th, where aging meets climate change. So we'll have a couple of experts on that call. Really looking forward to that. So before we sign off, Aiko, back over to you. What you think are the top priorities?
Yeah, I believe that, as we discussed, healthy aging is quite central to the well-being in old age, and really good health drives productivity, economic securities, and also, help with the activities, social engagement, and also reduce ultimately the long-term care needs. So this promoting the health, especially in our regions, in the cost-effective and efficient ways, are something that we really want to look for and drive with the evidence. And we also are aware that this intervention really has to start early, rather than when you say, okay, you're at certain age and let's have an intervention. It's very difficult to change habit, to understanding of the health, to preventative. So it really has to go with like lifelong or life cycle approaches, all the things that we talked about. And that would be really a key. So that means what that means is that early investment is really the essence. And these countries in our regions are just at the right moment to really, ramp up the investment, and hopefully ADB can make us, small but good contribution on that front.
So healthy aging, a life course approach to start early, and we need to get early investment. Well, thank you so much, Aiko. We invite everyone to review that report that Aiko Kikkawa was the main author of. It's there in the chat. Fantastic report. We invite you to kindly fill out our survey, and very much look forward to seeing you all in November. Thanks again, Aiko.